Our next conversation is going to be about medical research, and we've been having these conversations with the KEMRI WELLCOME Trust. Today, ours is going to be a bit different and big, okay? It's what we were talking about earlier, and we're asking ourselves, what is this all about? So, extreme weather risk insurance system, and it's medical research. All right. It's called New Risk, the novel Extreme Weather Risk Insurance System for Kenya. Well, to tell us more about this, we are joined by Dr. Moses Chapa Kiti from KEMRI WELLCOME Trust. He's a researcher, and Sharon Onyango, who's also a research officer at the KEMRI WELLCOME Trust. Dr. and Sharon, good morning.
Good morning.
Welcome to the hot seats of the Situation Room. Karibuni sana, how are you feeling? You well?
Good.
Sharon, you comfortable?
Yes.
Very
Thank
good.
you for having us.
Yeah. Chapa Kiti?
Yes.
Hujambo?
Sijambo sijui.
We were just talking to you. Now, KEMRI WELLCOME Trust is one of the constituents of Kilifi County. And today is Kilifi Conversations. All right?
Awesome.
Karibu sana.
Asante sana.
The first thing that you are going to do is, of course, hear the day's proverb from CT. Give us your translation of it and then your interpretation of it. CT, where are we?
We are in the Republic of Kenya.
Yes.
You both know where the country is, isn't it? Our proverbs are in the Kiswahili language, and then we'd like to ask you to interpret into English and then tell us what it means to you. Okay? Nimechoka kutangatanga. Hapa tatia nanga.
Nimechoka kutangatanga. Hapa tatia nanga. First, translation. Sharon, I want to start with you.
Translating to English?
Yes.
Okay. I'm tired of moving around. I want to set foot here.
Daktari.
I will change foot to anchor. I'll set my anchor here. I'm tired of moving around. I'll set my anchor here.
Yeah.
That's a nice one. Okay. Both meaning the same thing, is it? City? Okay. So what's your interpretation of it, Sharon?
Basically, instead of trying to focus on a specific task, instead of trying to gather everything around, just, focus. If you're particularly maybe talking about a specific area in research or career, then it's best to just set your foot in one specific place or the career that you've chosen, instead of trying to get sort of everywhere.
Being a jack of all trades.
Exactly, trying to be a jack of all trades. Yeah. Then you become an expert in that particular area.
Nice.
I will echo that and also add that I think in relation to what you're currently doing, there are a lot of things in the climate and health space, and you're now focusing on this project that is called New Risk. So we think it's something that it's worth talking about. We think it's a hill that is good to die upon.
Yes.
Yeah, so we are really setting our anchor on this, and we're hoping to share more about this.
Okay.
Yeah.
So let's just dive straight into it. What is New Risk, Doc?
New Risk. I think New Risk first is an acronym. So I can give the explanation in full. So it means a novel extreme weather risk insurance system for Kenya. So this can be broken down into several parts. I think first, novel is new. So this is something that hasn't been done before, and we are hoping to break good grounds with it. Extreme weather. What is extreme weather? I think these are things that you are currently seeing right now. Recurrent, frequent flooding that are of high magnitude compared to what we've seen before. Heat waves happening globally that have not been happening before. Things like sandstorms that are happening in other countries. Droughts that are prolonged and really take a toll on the human population. Risk insurance. So we are essentially looking at a system that can help our health system. And the health system comprises of different facets. So what happens if an adverse weather event occurs? What happens if a flood occurs? What happens if a drought happens? What happens to the population? What happens to our health facilities that are supposed to give services to people? And we want to see how can we design preventive measures or mitigation measures that you can put in place so that in case an adverse weather event happens, then we are sure that our population will still get service that they require from the health facilities.
So this is in the event of extreme weather events.
Yes.
What happens to our health system?
Exactly.
Because normally we think about the agriculture, the food security side, and all,
exactly.
and what happens to people's safety. Okay. So then, what do we need to think about when you think about all these things, Sharon? So yeah, we've been introduced to novel extreme weather risk. So coming to the other second part of it, the insurance system. What is it?
So maybe just to also still add on to what Dr. Chapa has mentioned, the New Risk Project has different work packages. So the insurance system is towards the end of it. So we have the first work package is on analyzing policies. And then the second one is on mapping of vulnerability, especially for the communities and for the health systems. And the third one is on the resilience of the health systems in particular, and also getting to know what communities are doing, how prepared they are towards this. And the last work package is on getting to know what is the cost of doing nothing and what is the cost of doing something. So it all adds into the fifth work package altogether. And not particular, like there are different aspects to it, not just specifically the insurance that comes out of it. We want to see, in terms of health workforce, what can be reinforced, in terms of energy, in terms of infrastructure, in terms of water and sanitation. I think the WHO has different standards to this, and probably Moses could add more on it.
What are health systems?
So health systems, these include the health facilities, the populations as well, all coupled up together.
Okay. So I'm curious, what could actually happen to facilities should there be extreme weather conditions? We never really think about that. What are the potential dangers or risks that could actually fall on health facilities?
I can give two examples that looks at both extremes of what we look at when we say extreme weather risk. I'll talk about extreme rainfall and I'll talk about extreme heat. So extreme rainfall would lead to a flood. So what happens when it floods? I think like in what we saw end of 2023 and early 2024, there are some hospitals which were actually cut off from the population, which means that people cannot access these hospitals for services. Roads were washed off, or the areas around were marooned, and you could not get to the hospital, which means that the hospitals also got inundated. The rooms were flooded, equipment were destroyed, you could not get vaccines to your children, you could not dispense primary medical care during an emergency situation. So that is one major impact. Health facilities get destroyed, and people around these health facilities cannot access the services that they're supposed to get from these health facilities. Number two, when you look at extreme heat, I think we are used to saying kuna joto, but then sometimes it is actually extreme. In fact, last year and this year, we've recorded the highest temperatures ever since the 1800s. So what does this have an impact on the health workforce, for example? I mean, you become lethargic, you become very irritable, you become dehydrated, your productivity really declines while you are at work. It becomes difficult for you when you're irritated or experiencing some other kind of emotional stress because of the heat. You cannot attend to your patients well. You are very angry, you are irritable. Even your patients, when they come to the hospital, they don't have a place to stay and cool down. You have mothers coming with children for vaccines, or people who are unwell with other conditions like heart disease, kidney problems, etc. So they are not able to really perform the way they're supposed to perform. Because of these kind of heat things that are happening.
Okay.
Yeah.
So if I understand this, these are conditions that come about as a result of nature, right? You may not have any control over it. So where would risk insurance come in? Because usually when you look at it, insurance would be to mitigate against a particular condition, or at least to help you take care of it. So where does insurance come in now to alleviate situations, or what does it do exactly?
I would look at insurance as the way you'd normally have your health insurance. You are basically paying a premium to someone or a company to enable you to access these services at a point where you actually do need them, especially if the finances are supposed to be high if you're paying out of your pocket. In agriculture, as has been mentioned, you have farmers insuring their animals or their crops in case drought or flooding occurs and they cannot get pasture or they die. So you have these insurance companies paying off the farmers for the loss that they actually do incur. So in this health, what we envision is having a system whereby you can potentially pay premiums to a company. Then in case your hospital gets flooded, for example, you don't have to wait for the government to come and give you money to repair this facility. Then you have the insurance company working very fast, giving you the money to actually pay contractors or any other person who would repair the facility and replace equipment almost in real time. I think when you talk about risk, it's not just about the finances and that. There are also measures that you can put in place to mitigate the potential effects of this flooding and heat. For example, you can design your facility in such a way that you have very good drainage. If it rains, you actually don't get inundated by the flooding, like raising the platforms or having very proper drainage around your facility. If you're working in very hot places, such as Turkana or in the northeastern, you ensure that you have proper ventilation. You ensure that you have water systems for these health workers. They can drink water as they are working so that they can stay hydrated.
So these are preconditioned mechanisms.
Exactly.
Okay.
Yes.
Okay.
You talk about new risks. What were the old risks?
I think the risks have always been there. They are getting worse.
It's the extremity of the risks that make them new.
Actually,
we've had bad weather, but the bad weather we're having now is like nothing we've ever had before.
Yes.
So it's the extremity.
Yes. Yes.
I like this piece of research because previously when you talk about climate change and the impact on climate change on communities, we are looking at their resilience in terms of food systems. We are looking at their resilience in terms of surviving, getting access to water. But hardly do we talk about their access to health. And this is one that now is looking at what actually happens when you have these extreme weather systems and the impact that they have on the people's access to health, which is like a basic, right?
Yes.
And yet nobody appears to have thought about it before you and your team, Daktari, decided, let's actually conduct some research into this and see exactly what happens.
And they're touching on is you're looking at the economic well-being of the individuals who are affected, because your economic well-being or the lack of it thereof also has a very direct impact on your health outcomes. So this particular study seems to have given it a 360. But there's something that I like in all this: vulnerability. The thing that makes you most at risk.
Yes.
How do you measure this?
Well, there are different methodologies for measuring this presently.
I know. See, you don't measure the ruler. That much I know.
Yeah, so it could be in terms of their social aspects, it could be their livelihoods, it could be socioeconomic impacts. So there are different aspects to measuring vulnerability. So depending on the particular aspect of vulnerability that you're looking for. So currently we're doing a scoping review. A scoping review basically is checking to see what is happening in Africa, what types of methodologies have been used, what can we borrow that can be adapted to our local context.
When we talk of vulnerability that is brought about by, say, for instance, the extreme weather, extreme climatic changes, the first port of call is to look to the government. And we're saying, no, you don't necessarily have to look to the government. There are people who can actually assist. How would this insurance work? Because, yes, the nature and the manner in which the insurance industry works is understood to some degree, at least I understand to some degree. How will this one work? Because this particular one, if it is insurance, then it puts the insurance company at risk.
You are right. I think at the moment we will talk about it as our hypothesis, because we are yet to get to the point where you can say this is the kind of intervention that you can put in place as an insurance system. So we have ideas of what we think can actually work, but as part of these work packages, we intend to listen to the community and ask them, I mean, do you consider yourself vulnerable, first of all? Because when you talk about vulnerability, in the natural sense, someone living in Muthaiga may be less vulnerable compared to someone living in a slum, for example.
Madari, which is
yes.
next door to Muthaiga.
So the vulnerabilities are different. But if you are talking to someone who is in Northeastern who has 20 cows compared to someone in Nairobi who is probably driving a car, etc., again, your vulnerabilities are different. But then if you don't understand how this individual actually perceives if they're vulnerable or not, I mean, 20 cows, I'm rich with my camels and everything. And here you're also considering yourself rich. But if we look at our vulnerability analysis and we compute our metrics, and we look at it and we say, because of your social economic status, because you don't have roads, because you're living in a mud house, you're actually poor and vulnerable, then that is not entirely correct. So first of all is to understand how does this vulnerability actually pan out in the entire country for different people.
Do we also understand how it is that these communities have mitigated against risks that have existed before? Because we're talking about new risks.
Yes.
Because the risks have been there. Do we understand, or have we taken the time to understand how it is they went about mitigating against the risks that they faced?
Yes, and that will have been my second point. After talking about the vulnerabilities, then is about now understanding the indigenous knowledge. How have these communities actually, first of all, do they even know what climate change is? You know, as scientists, when you talk about a 1 degree change in temperature, for us it's very, very clear what impact it has. But if you tell someone today was 28, tomorrow is 29, you know, they really don't feel it.
Yeah.
But then it has a lot of other implications in the entire ecosystem, you know. So if you talk to communities through like our work package 3 that talks about community engagement and understanding what they understand about climate change, what kind of measures do they actually put in place to mitigate the impacts of climate change, you know, like crop rotation, migration from one place to another whenever they see signs that floods are going to happen.
Yeah.
These are things that our grandfathers and other people who have gone before us used to do. So we don't know all of this. We still want to find out what did they used to do.
What it means.
Yes, exactly. And then it will also potentially guide us to know, if you're talking about now a health system, how can we look at these vulnerable populations? What measures do they use to put in place to ensure that they actually still access facilities or get good health care? Then we can potentially incorporate that into the economic modeling and the policies that we may want to put in, to suggest to the government to put in place as mitigation matters. Yeah.
Interesting.
All right.
And this is a brilliant piece of work that's being conducted by a group of researchers from the KEMRI WELLCOME Trust and working in collaboration with other researchers from Oxford University in the UK, right?
Yes.
Moses Kiti is one of them. He's here with us. Sharon Onyango is another. She's also here with us. Emily Odipo from KEMRI WELLCOME Trust. Neven Fukar from Oxford. Mishoke Maina from KEMRI. Noni Mumba from KEMRI. Patrick Farr from Oxford. Emilda Okiro from KEMRI. Jacob McKnight from Oxford, and Benjamin Sofa from KEMRI.
Yes.
All of you are working on this one.
Yes, we are.
It's called New Risk, which is an acronym for Novel Extreme Weather Risk Insurance System for Kenya. Brilliant piece of research, just looking at how extreme weather systems and cycles affecting health systems in Kenya, and how can that be mitigated against. This is a conversation that we're having this morning with our guests from KEMRI WELLCOME Trust. We're having a conversation about new risk. It's not a new risk. It is the acronym for Novel Extreme Weather Risk Insurance System for Kenya. And this is the new research that's being conducted by a team of scientists from KEMRI WELLCOME Trust in collaboration with the others from Oxford University. The team from KEMRI WELLCOME Trust are here: Moses Kiti and Sharon Onyango. Kenya experiences diverse weather patterns, periodically leading to extreme weather events such as floods and drought. The nature, frequency, intensity, and distribution of these has been changing over time. In last year alone and this year, Kenya experienced extreme flooding in 40 of our 47 counties. This led to deaths, displacement, and infrastructure damages, including more than 60 health facilities. So, what do we need to do to understand the impact of this extreme weather on our health facilities? What do they need to do to prepare for these extreme weather events, because they're happening more and more? And this is where the insurance part comes in. Yes? Yes. So one of the things that you're talking about in this research, Sharon, is you are going to look at health facility assessment. And you mentioned this briefly, but just go straight into it. In this research, no. The first question was going to start with, where are you in this research? And what are the next steps?
Okay, so we are in the first stages of this. We just started the project this year.
Okay.
So we're in the very preliminary stages of it. The different work packages have different tasks that they're going to deliver. So for each work package, there's a bit of work that is ongoing. We are particularly in work package 2. So as I mentioned earlier, we are currently doing scoping reviews. Our work package 2 is for population vulnerability mapping and assessment. So we're currently doing scoping review around this to see what type of specific weather events that are affecting Kenya, which populations are mostly affected. So for work package 3, they are working on assessment of health facility preparedness. So it's also work that is ongoing. So the timeline probably, it's about 4 or 5 years, if I'm correct. So for now, we're just in the preliminary stages. I think as time goes by, we will be able to disseminate and give quantitative feedback on this.
Oh, will you only be focusing on health systems? Because then, when people hear extreme weather and the vulnerability and the impact on populations, for example, very many questions are coming in. So, for example, what we saw flooding in Marsabit, does it mean that people would have been able to repopulate their livestock? Is your research going to focus on the impact on the health systems and the health of the populations?
Yes, it cuts across both. As I've mentioned, the different work packages work on specifics. So work package 2 is for population, work package 3 is for health systems. So all of it, we're going to be doing it together, and it's for the entire country. As you've seen, we will take it for the scoping review. It's for Africa, and then taking it all the way to Kenya within the specific climate zones. So we've also narrowed down later. We will be narrowing down to Kisumu, Kilifi, Kirinyaga, and Turkana to get to see at a downscaled, micro-scale level what are the type of vulnerabilities that are experienced by these populations as well as the health systems.
Sorry, go ahead, Eric.
You wanted to come in.
Yeah, I can also add on what Sharon has said. I think 2 major things that we expect as output from this research. One of them is we are also going to do some climate modeling work to understand how has it been in the past and how do we project it to be in the future, so that we can see if you're talking about understanding vulnerability, we're looking at the impacts in the future. We're not talking about what has happened in the past. So we want to understand what happens next. What if a flood happens in this area? Who are the people who are there? Which health facilities? How have they been designed? And how can we ensure that we put necessary measures in place so that they are not affected as much as they would have been if you had done nothing at all? The second thing, and this climate data can be used across different ministerial agencies or any other people who want to use that data for similar work. The second thing is the vulnerability analysis. So yes, we are focusing on health, but it's something that can be used by many different agencies. Again, if you understand which people can be most affected by a disaster, then that gives you a very large playground that you can work with. For example, if you think about if there's an accident somewhere and this is the type of road that is there, these are the people who are living around this area, they are disabled people, they are elderly people, then specifically what kind of help are you going to take to that area. I mean, if people are on wheelchairs, you need to go with, people are disabled physically, for example, then you need to go with facilities which can actually help to evacuate them from that particular area. So in terms of risk management and emergency evacuation, even planning for agricultural relief food, for example, then this can actually be used across very many different sectors done by the government.
How did you determine to work in Kilifi, Kirinyaga, Kisumu, and Turkana?
Good question. So we've already done some preliminary climate modeling work, and what we wanted to actually see is which areas are undergoing what we are calling climate change. So, for example, which areas have exhibited increases in temperature, for example, compared, if you're looking at now compared to what has been happening in the last 50 years, or which areas actually have more frequent and more recurring flooding scenarios, such as in what is happening in Kisumu. Again, looking at it in terms of where we expect to find vulnerable populations. For example, in Kilifi, we know and understand that poverty levels are high, social economic status are low. We also have a very good platform in Kilifi that colleagues who have come before me have talked about. We have a health demographic surveillance system that has been monitoring people over a period of time. I think over 20 years now, that you can use as a basis to actually understand more the impacts of climate change that has been happening over time. Same for Kisumu, we have a similar system. But a place like Turkana, that's a bit far off. It's a bit understudied, I can say the same. And these are places where we actually do expect also to observe high vulnerabilities compared to other areas that are there in Kenya. So we were looking at areas which have exhibited different climatic changes, areas with different potentially kind of vulnerabilities, areas which will potentially require us understanding the situation, and we can generalize that to other parts of the country that have similar populations or social economic status.
Why
Kirinyaga? Let me try to remember. I think Kirinyaga is experiencing different kind of conditions compared to these other areas that you have. Okay. I think one of them is, in addition to that, we have facilities whereby it is potentially easy for us to go into because we have some rapport with some of the medical personnel working in these areas. We also identified this based on our climatic change map that we have done. So looking at areas which are potentially going to experience an increase in temperature over time. So that's why we think that it is important to do that. Again, at the same time, this is an area that also experiences very low temperatures. And if you have an increase, then it's going to actually have an impact on the population in the near future. So that's why Kirinyaga is also interesting to us, for us to study. Yeah.
It's interesting as you do the study and as you do the research and say, okay, well, these are the patterns that we see. And based on that, then we're going to probably be able to benefit from this kind of intervention, in this case being insurance, right? But then it also strikes me that there would need to be the resident infrastructure upon which this would sit. And whether that's at a government level or, whatever, would it need to work hand in hand with resident infrastructure, existent or non-existent, to ensure that then the results of the research then are not wasted? Because I can say, Kirinyaga, Turkana, it's necessary for me to have it. But if I don't have a receptor, then it's difficult, isn't it? True. So how do you go about, how would you envision going about that?
Yeah. One of the things that we did earlier on is a stakeholder mapping exercise. So we looked at different entities. I think we've had communications with the Council of Governors, we've had communications with Kenya Meteorological Department, and direct communication with the Ministry of Health in the various countries that we intend to work with, and also in consultation with the Ministry of Health in Kenya. So these are individuals who have also expressed interest based on what they perceive as their needs for us to go and work in their counties. So yes, there are existing infrastructures. As researchers, what we know is what is on paper, and most of the times what is on paper is something that have been documented in the past. So now we want to go in and understand what is actually on the ground. from our researchers' perspective, the WHO has developed tools that we can actually use to assess these facilities, but working with stakeholders, working with communication experts, other health systems experts, we want to modify these tools so that we can actually capture what is contextual for our country, rather than having a very generic tool that may not really work for our situation. Then that is what now gives us guidance that when we go in, we will actually be able to capture data and process information that will be very relevant to the counties that we will be working in. Yeah.
You know, the thing about research is it seeks to answer or respond to certain questions. What was your question?
Our question is, the basic question is, can a risk insurance system, can a risk insurance help our health system? That is a basic question. Yes.
Valid question.
No, it is it's an extremely valid question, because it looks like climate change is with us.
Yes, it is.
And the extremities that we're speaking of. But then there are those who say that some of these changes we are seeing are not really new. They say that the fundamental difference is that they are occurring a lot more frequently than they did in the past.
And more severe.
That seems to be what some people are saying. So does this therefore then lend credence to everything adverse that we've heard said about climate change, and how it is that we as human beings are directly responsible for the harm that we are now facing?
Yes, it does. And as human beings, we are directly responsible, because about over 80% of what we are now seeing as impacts of climate change are actually brought about by what man is doing in the planet. Burning fossil fuels, like traffic, deforestation, and such kind of practices which are actually detrimental to the environment. So yes, we have had extreme weather events in the past. I think that is very true. What we are now seeing is, as you've said, increasing in frequency, increasing in magnitude, and we, from projections that have been done by climatologists, we're actually seeing that this is going to happen more and more in the near future. As you've seen, I think in the last 2 years, or actually in the last couple of months, we've had wildfires in the US. We've had very severe flooding in Spain, for example. We've had cyclones happening in Mozambique, just our neighbors here. So these are things which used to happen, but not as much as they are happening right now. And the destructive force that are actually impacting on the humans is actually more than what it was in the past. Yeah.
There are many fears that the output of your research will come out with data and information that shows that our health systems are ill-prepared, our communities are ill-prepared to handle adverse effects of climate change. And this therefore will mean that insurers will then say, well, I cannot take up this because you're higher risk. Your risk then is higher. That makes insurance more expensive. Instead of it now being of benefit, it becomes an eye-opener to those number crunchers at insurance companies who now start saying that you're more at risk.
That's a valid point, and we acknowledge that. And I think what we will want to say is, when you talk about insurance, it's not just about the financial aspect of paying premiums to a company to help you mitigate against future things that may happen. So there are other insurance things that can happen. I think we use insurance broadly, but there are many aspects which Sharon had alluded to that you can actually also implement. Like, for example, if flooding happens and there's an outburst of diseases, can you take additional health practitioners to go and assess the situation on the ground at the moment? If you are experiencing heat waves in a particular facility, can you improve the infrastructure in such a way that it makes it more comfortable for the staff working there and the patients coming in to be able to sit and get attended to at that particular time?
It's a mitigation and planning measures.
Exactly.
So the information here should help the planners
Exactly.
to know that this is what's likely to happen in this area. When the weatherman says expect the rains to do this and the other in the months of October, November, December in this area, then those who are involved in various departments will know that these people are therefore more vulnerable, and we need to look at how to get food to them. We need to how to send in more health workers there. We need to. This is what it help. This is what it will help.
Yeah.
Okay.
Yeah. And just to add also, remember we're looking at also two very extremes in our economic modeling.
Yes.
What happens if you don't do anything
Yes.
versus what happens if we do something? This something, I think, is something where we are still working on to determine. But in between these two extremities, there are very many other possibilities that can actually come into place. And this is what we'll be looking at in the models and seeing which can potentially be the best outcome that can be implemented by different development partners.
So from what I understand about research sometimes, Sharon, is that even when you're starting and you're looking through and looking at all the different details, you imagine a situation to which this research would be applicable, right? And you can see it playing out in your mind and say, okay, look, this is how it would actually be if we applied it. Let's take the floods that happened in Kenya 2023 into 2024. If this would be applied to that situation, what would we have seen that would have been different with the application of these findings?
Okay, if maybe I would say that an example would be in the health workforce systems. So this is still in line with when you're doing research, you have to use some guidelines, which now the WHO gave on vulnerability assessments. So in terms of maybe the health workforce, how maybe what type of need, or maybe what type of, how do I put it? What type of health workers would we need? If it's nurses, if they're overwhelmed, would they need assistance, like ward assistants, to help, assuming maybe an outbreak of cholera, or assuming maybe the different vector-borne diseases that come as a result of these extreme weather events? Do we need more workforce in terms of adding more nurses, adding more doctors? Do we need to have, as he mentioned, as Dr. Moses mentioned, do we need to put our infrastructure in place in terms of maybe if it's during the heat or during when there's like high drought, there's need for ventilation, which could actually in turn incur high energy cost. So do we need to work together with architects to help redesign these hospitals and such interventions?
There is risk. There is insurance that deals with what we discussed. It's called catastrophe insurance. And if you look at the list of what they insure, it's actually interesting. Hurricanes, floods, storms, earthquakes, volcanoes. Imagine. Now, just with this in mind, if we are looking at, because what we're looking at here is something that is going to occur more frequently with time, as we've observed. Everything else that I've mentioned here have their cycles, but the cycles were far and few between. They were not an everyday occurrence. When you look at what it is that you are seeking to study, or the question you're seeking to answer, against insurance that already exists for catastrophes, because what we're discussing are catastrophes, can lessons be learned from where these things have been applied to our country? Because I'm not certain we have those types of insurance in this country. I'm not certain. I don't think we have them.
Well, no, we don't have such in Kenya. That's why, taking it from an example of the agricultural sector, they already have a risk insurance for maybe their livestock, which actually is in place and it's working. But there's none particularly that can curb or help us work around these catastrophes, specifically for the health sector.
So they have life insurance for cattle.
And for me,
more or less.
more or less, yeah.
Yes, they do.
When it comes to the consumption of the research, right? So you expect that it should be taken up by those in offices that have a responsibility. But also, should communities also get this research so they know that yes, this is what has been said. If we don't do anything, if nothing happens, this is the risk that we face. And if something happens, some of which we can do ourselves, this is how we can save ourselves. How do you ensure that the communities that you're actually going to research on get this information?
An important thing that we are doing is what we are calling co-creation. So as part of our work package 3 that deals with the community directly, we're actually, first of all, is engaging them as we are planning the research to understand what they consider as important to them and what they actually think would potentially work for them. This will also include disseminating first of all, seeking to understand what they know about climate change and how it has an impact on them and their health.
Yeah.
Then, as we are having those conversations with the community members, we will also be disseminating to them that this is what we know. We now know what you know, and there are other things that we can add onto this conversation. So this is what it is: climate change. This is how it will affect you. And as we're discussing about this and taking into account the indigenous knowledge that they actually do have about what they have actually been doing in the past to minimize the impacts of adverse weather events, then these are things that we can actually potentially incorporate into our own thinking, into our own economic models, and have them and propagate them and see. We have our own thoughts. But if you account for what the community thinks and what they actually do prioritize, then we can actually come up with a hybrid system that is acceptable to the community members,
right,
that is actually practical and works according to what we have seen from our model outcomes.
Yep.
And we can actually now introduce this to various agencies. I think we've mentioned that we are working closely with the Council of Governors. So these are people who have already given us their buy-in in terms of the research. So we're hoping that we're having these conversations with them, and especially health being a devolved function, we're hoping that we actually have the buy-in from the start. This is what we are studying. This is what we expect to get. This is what we now have. Let's now have another round table. We present our findings. Then we discuss what do you think would actually work for you, given everything that we do have, especially the obligation to be paying money to the insurance company to cover you, because that is definitely a very huge thing.
It's a big conversation.
Yes, it is.
Dr. Moses Chapa, Kiti, researcher at KEMRI Wellcome Trust, and Sharon Onyango, research officer at KEMRI Wellcome Trust, who are part of a team conducting a research on the novel extreme weather risk insurance system for Kenya. They've been our guests.
This is the Situation Room, the only way to start your day.